We're staying with the breath today with a focus on the lungs. Thousands of people are diagnosed with lung cancer each year, and because there are no symptoms during early stages, it is very difficult to detect, Joe.
It's also a part of our bodies that we rarely pay attention to, because do you think about getting your lungs checked out?
There's a part of your body you really should pay more attention to. It's your lungs. Men, women, the young and old. Visit lungfoundation.com.au.
Such a powerful message there, the way that people, have to really be aware of your breath and how your health of your lungs are. Because when you think about lung health, the first thing you think about is smoking. Not that all lung cancers are caused by smoking, but a big percentage are these days. And you know what? There's really no excuse to be unaware of the risks of smoking.
There isn't, and it is getting harder, which is, I think, a really positive thing. I mean, there's very confronting messages on the packaging. A lot of places are banning it now. We're seeing, initiatives like World No Tobacco Day, so it's a really positive thing.
And I think what's really exciting is that we're seeing such a shift, especially in young people. I think it's halved since about 1995, which is incredible stuff.
Yeah, it's had an impact, but thousands of people are still diagnosed with lung cancer each year, Joe, which is why a group of very progressive doctors are doing their bit to change that with a lung cancer screening trial. It's being held Australia-wide, and already it is saving lives.
Sure. Have your head on the pillows and feet down towards the bottom end of the table here,
sure,
please.
No problem.
77-year-old David May smoked for 42 years. He comes from the era when smoking was the norm.
Everyone smoked. It was fashionable, and nobody saw a problem with it. And so I was surrounded from an early age with secondary smoke.
Do you have any questions before we start?
David came from a family of smokers, and even though he gave up 18 years ago, his family history prompted him to take action.
My mother, who smoked right up until she literally was diagnosed with lung cancer in 1995, so she died of lung cancer, and I guess that sort of woke me up a little bit to the fact that it could be me one day.
We're looking at people who are at risk of lung cancer, and that means they've got a current or former smoking history.
And hold your breath.
And we're looking for the older population as well. So we're looking for people above the age of 55 and below the age of 80, and who are otherwise, generally healthy.
Dr. Henry Marshall is part of an early detection lung cancer trial. 2,000 participants are being recruited all over Australia as part of a larger international trial.
With most cancers, if you pick them up at an early stage, when it's small and hasn't spread, that's your best chance of getting a cure. So Angela, here's your chest, starting at the top and then working all the way down through past the heart, spleen.
I was about 13 years old. My best friend at the time, Kerry, her mother smoked Alpine cigarettes, and both Kerry and I just loved Alpine cigarettes.
Your arms above your head, nice and straight back at the elbows.
55-year-old Angela May smoked 30 cigarettes a day. She gave up 6 years ago.
I actually enjoyed smoking, so I didn't really want to give up, to be honest with you. And then I decided that when I couldn't walk up a flight of stairs without, huffing and puffing, I decided it was probably time to stop.
Angela had no idea that her father David was taking part in the trial too.
After I stopped laughing for 5 minutes, I said, so was I.
Fortunately for both David and Angela, their results are all clear.
We've had already several people who've been diagnosed with early stage cancer who have had curative surgery. We've had at least one participant with 2 different lung cancers picked up who's successfully undergone surgery on both lungs and quit smoking into the bargain. And many other people have also quit smoking because they've been really thinking about their health, and it's given them, I guess, an opportunity to really work hard on quitting.
I don't really have any friends who smoke anymore, I don't think. A couple of people at work vape, but that's about it, I think.
Definitely, I would advise anybody who has the opportunity to get tested.
And at the May household, there's definitely one item that's now obsolete.
Except we don't bring the ashtrays out.
No. Haven't seen an ashtray in years.
You know, that is true. You don't really see ashtrays where you go anymore.
No.
Remember in the old days, people would smoke on planes?
Oh,
they would
so
smoke
bad.
in offices. And my husband reckons he remembers a teacher in the 80s smoking in the class.
Yeah, I'm really glad they actually don't do the ashtrays anymore because they're forcing people to carry little jars with them,
Yes.
which is another form of, I guess, hopefully, getting them to wake up and realise, oh my God, I'm carrying around this stupid jar for disgusting.
Doctors used to actually prescribe smoking for stress, you know, going back in the 50s and 60s. So we've come a long way. Joining us now to tell us more, Head of Lung Cancer at the Royal Melbourne Hospital, Professor Lou Irving. Lou, welcome to the House of Wellness.
Good morning.
Thanks for joining us. Tell us, how did these trials come about?
So we know that this new technology, CT scanning, has the accuracy to pick up early cancers, and so the trial is now looking to see whether we do more good than harm by regularly screening people who've been heavy smokers. And, you know, harm can come from screening. We can pick up things that aren't cancer. We can worry people unnecessarily. We can do extra tests that we don't need to. So the aim of this trial is to look for the benefit and make sure that it outweighs the risks.
And we saw Dr Henry Marshall in Brisbane there in that story before the break. So where is the trial being run in Australia?
Yes, in 4 states, in Queensland, New South Wales, Victoria and Perth. And we're each recruiting 500 patients per centre. And there's a Canadian centre as well. So it's a true international study.
And are you looking ideally for people who have been smokers?
Yes.
Right.
So ideally they've smoked at least, what we call it a 20-pack year history. So the equivalent of smoking a packet a day for a year, for 20 years, or 2 packets a day for 10 years. That would be a 20-pack year history.
Wow.
Professor, can you talk us through how the trial is actually run? What happens?
Yes, so there's people self-volunteer, although we've found that it's often a family member who suggests, and they fill out a questionnaire that relates to their cancer risk. So we're looking for the highest risk people, and that relates to their age, to the amount they've smoked, to a family history of cancer, and whether they've been exposed to asbestos or other carcinogenic dusts and so on. And the study involves 2 CT scans separated by 2 years. We also check their breathing capacity because we know that people who've got reduced lung capacity related to smoking are more likely to also develop lung cancer.
So if something is detected early, does that mean that they've got lung cancer straight away, or...?
So we find in about 20% we find a spot, and of those spots about 1 in 10 of the spots turned out to be a cancer. So for example, we've screened just over 250 people at Royal Melbourne Hospital. We found 6 cancers, 3 of them were early lung cancer, and the patients have undergone successful treatment. 3 of them were actually cancers from other areas such as breast and pancreas.
So you're in year 3 of 5 for this trial. What are we hoping for at the end of this?
Well, for a better understanding of the sensitivity of the CT screening, a better understanding of how to identify the highest risk patients to recruit, and a better understanding of the cost versus the benefit. So we would like to see a lot of benefit for relatively low cost.
Professor, I find that, sorry Joe, I find that really fascinating that we're now actually having a bit of a discussion around screening, because we're told often, got to screen everything, early detection's the key, get in and you can often be sent off to multiple screenings. So you're saying, hey, let's get some research and make sure that the benefit outweighs the risk, because there are some risks attached.
Absolutely. And those risks include unnecessary extra procedures if there are little spots that turn out to be something nothing. They include the psychological trauma of worrying about something that's not there. And they also involve the risk of the radiation itself from the CT, although it's relatively low radiation.
So you are calling for smokers, and I have to say that I'm a former smoker, socially, of course. I have a huge amount of compassion for people who still smoke, because we assume that you can just give up, and it's not easy. It's very hard to give up, and some people can't. Is there a stigma associated with these people, and are they perhaps not so willing to come forward to volunteer for the study?
So the answer is yes. And interestingly, on the basis of the current data, in America, screening is now funded nationally, but they're actually having trouble recruiting people, probably for the reason that you've indicated, that people who are smoking feel that they've got a self-inflicted condition and they feel that their life isn't worth it compared to other people.
Well, that breaks my heart. What do you say to those people to encourage them to, you know, perhaps not beat themselves up so much like that?
Yeah, and I think positive reinforcement. I think acknowledging that nicotine is a highly addictive substance, that some people are more addicted than others, and that there are ways of quitting. There are established techniques for doing that. And we know that if people really want to stop, if they keep trying, they're highly likely to quit, like you did.
Professor Lou, you're the person I want to come and see if I'm in trouble. You've got that nice calming voice. I just feel relaxed automatically. Congratulations for the amazing work you and your team are doing, and more strength to your arm.
Thank you.
Professor Lou joining us with a big study happening around Australia. After the break, the fight to scratch out one very persistent itch. That's next on the House of Wellness.